Good evening and welcome to another episode of Easy Access to Healthcare for All, a program which brings you news and issues around the National Health Insurance Scheme. I am Aisha Muhammad Ahmed, your anchor. With the recent onboarding of core members into the health insurance space through the GIFSHIP-n program, the NHIS is building capacity and making sure stakeholders are on the same page when it comes to implementation. Towards this end, the scheme organized a two-day workshop which brought both the NHIS and NYSC state and zonal coordinators together to discuss the issues. The 6 health maintenance organizations were also part of the workshop aimed at breaking down the operational modalities of GIFSHIP-n that will help boost its implementation in various states. The issues discussed at this workshop and the response of stakeholders to the GIFSHIP-n program make up our package of the program this week. Why don't you join me after the break for details? Do stay tuned.
Easy access to quality healthcare for all. NHIS.
We begin the program with a highlight of news events around the NHIS. In the news, NHIS debunks telecom tax news, and in Bauchi, NHIS trains stakeholders on basic healthcare provision fund. Details in a moment.
The management of NHIS has refuted the news on the telecoms tax making rounds since the signing of the act into law. This is contrary to speculations that coals will be taxed as a source of funding to cover healthcare for vulnerable groups. In a press release by its public relations officer, Mr. Emmanuel Onuwokpono, the NHIS stated clearly that the legislation that Mr. President assented to does not make provision for telecoms tax as a source of funding. He, however, says the new act strengthens the National Health Insurance Agency to ensure that every Nigerian receives access to quality and affordable health care, stating that Section 25 and 26 of the Act, which establishes the vulnerable group funding, indicates the various sources from which funding will be drawn. While thanking all stakeholders for their effort in seeing that the NHIS Act is passed, the NHIS spokesman called on industry watchers and the media in particular to wait for a formal unveiling of the new law and modalities by the agency. The NHIS recently held a 5-day specific workshop on the implementation of the Basic Healthcare Provision Fund for Northeast Zone in Bauchi. The training was geared towards educating and building the capacity of implementers of the program. It was a convergence of both NHIS staff as well as staff of state health insurance agencies across the Northeastern Zone. The training had several presentations on various topics relevant to the Basic Healthcare Provision Fund, like a general overview of the fund, finance policy and financial regulations, and quality assurance in the BHCPF, disbursement of funds, etc.
We were made to understand has 7 parts. 1, 2, 3, 4, 5, 6, 7. But our major concern is on part 1, particularly part 1, section 11 of this act that gave birth to the BHCPF that has brought us here today. And I've said it as an intervention. It should be used for the purpose for which government has released this. It's an intervention that is meant for which gather of people. The target group, who are the target group? The target group. The vulnerables. The program is meant for this thing. But as I speak to you, when this fund started trickling out, so many places today that we thought is for the vulnerable. Some of us have started accessing care.
Participants shared their views on the training.
Oh, I'm highly impressed with the development. The lecture was excellent, and the lecture given was very educative. We are very happy. I've taken a lot of things home actually because the training was absolutely good. Mainly I've learned a lot from the lectures delivered, and advocacy we are already carrying out.
Actually, this training has added a lot, for it has abreast us from where we are to how to best use these funds disbursed to us at state level. The utilization of basic healthcare provision funds at the best level practice, and even for accountability and monitoring at the facility levels. Our coming together and sharing ideas on processes and procedures have really improved us for better execution as we return to our various offices.
Welcome back. Following the recent enrollment of core members into the National Health Insurance Scheme, strategies to make its implementation seamless are being put in place by the NHIS. One of such is the recent stakeholder engagement workshop held in Abuja for implementers of the GIFSHIP-n, during which the operational modalities were discussed. Let us take you through the activities that characterize this workshop. Please stay tuned.
Easy access to quality healthcare for all. NHIS.
On the 11th of February 2022, the National Health Insurance Scheme flagged off a health insurance program to cover members of the National Youth Service Corps, NYSC. Following the flagging off of the program, Corps members across the country can access healthcare without worrying about payment. The Corps members were enrolled under a special package known as the GIFSHIP-n. The GIFSHIP-n program is designed to provide health insurance cover for National Youth Corps members so that all serving Corps members can have access to adequate and quality healthcare services.
Thank you. Please, you may kindly resume your seat.
And so, in line with its major strategy of ensuring effective implementation of its programs through strategic stakeholders engagements, the NHIS organized a 2-day workshop on the operational modalities on the GIFSHIP-n. The General Manager, Formal Sector, Dr. Eke Jonathan, gave the opening remarks at the workshop, which held in Abuja.
So, welcome to today's.
He said a lot of work has been put in place to create a framework.
I am very, very delighted today that we are able to come together, to sit down and look at this NYSC program. I am quite aware that a lot of work went into developing a framework for this program. And not all of us in this room know the framework. When we started the implementation of the program, a lot of challenges which are normal in a new program reared their ugly heads, but we're able to at least keep them behind and make sure that the program started. Because if we said, okay, let's put everything properly before we start, we wouldn't have started the program up to today. The key essence of this workshop is to acquaint us with the contents of that framework, so that by the time we go, there are so many things that beliefs we had before that we begin to understand the perspective from where we are coming. And now we begin to work harmoniously together to see that this program is implemented for most effectiveness and efficiency.
Welcoming participants, Mr. Omotade, co-chair, Joint Implementation Committee that developed a framework for the program, commended the management of both organizations. He said the training was for both schemes to help the implementation of the program. He then urged participants to maximize the moment and learn from each other.
Today, we are witnessing the first edition of training workshop for field officers of both schemes, beginning with the northern phase. All these efforts are geared towards smooth takeoff and proper administration of a comprehensive health insurance policy for core members that will promptly address their health needs. It is indeed worthy of note The benefits of the enrollment of core members in this program are far-reaching and profound. Management is beginning to enjoy a huge relief of the burden of catering for core members' medical expenses, coupled with access to quality and professional health care at any given time, irrespective of their locations.
As the training progressed, its objectives were spelled out by Misari Ibiam of the NHIS Formal Sector Department.
By the end of the program, we want to be sure that we have done justice, we have increased our knowledge. And the last but not the least is to create an atmosphere for effective bonding. That's actually why they said you should see it according to your states. NHIS and NYSC staff from the same states sit together, because I'm sure you've been interacting in your states and you've been seeing something, so you can exchange notes while the program is going on. So it is for effective collaboration and generally for the success of this program.
There was a presentation on healthcare for core members pre-GIFSHIP-n. It was by Omotade Folorunsho, and the essence was to remind participants of the state of core members' healthcare before GIFSHIP-n.
This often runs into millions of naira. There are many ailments that core members bring to NYSC now. They are not incidental to service.
The GIFSHIP-n framework was presented by Dr. Eke Jonathan. It touched on what led to the creation of the GIFSHIP-n, how it was adapted from the GIFSHIP program, its benefit package, funding, etc.
First, to design this framework for the coverage of NYSC core members based on the NHIS GIFSHIP. We know what GIFSHIP is all about: group, individual, and family social health insurance. It is important for us to understand, to underline social, because when we are talking health insurance, there are so many types. So, but what we are doing in Nigeria is a social health insurance. It's a non-profit type of health insurance to achieve a social objective. Then the second one, we want to adapt the GIFSHIP to provide access to the NHIS standard benefit package. If you see the implementation under the NHIS standard benefit package, there are things we call co-payments. We have taken this out for the coppers. So under the standard NHIS, when you go to the hospital, you are expected to pay 10% cost of drugs.
Kakono Eteng of the NHIS took participants through GIFSHIP-n business process, outlining the program for coverage for NYSC, its funding, grievances, and resolutions.
The cost of providing this health insurance under NYSC GIFSHIP NYSC is paid per person per annum. NYSC manages these funds and pays these funds disburses these funds to the HMOs who pay to the facilities in the provider payment mechanisms, capitation and fee for service. This looks rather dark. It just gives an overview of what I have said. The fund administered by NHIS, the federal government is the one that pays. NHIS will disburse the funds to the HMOs, capitation for primary care services, fee for service for secondary care services. Claims processing will be carried out by the respective HMOs selected by NYSC, for which there are 6, and the vetted claims will be verified and the HMOs will pay the company.
In an interview, Omotade Folorunsho speaks more on the impact of GIFSHIP-n since its commencement.
I can tell you and be on the rooftop and shout Eureka. Eureka, because you had me with a passion when I told the class the arrangement before the advent of this new initiative. It's a whole lot of responsibilities on the management of NYSC to cater for the health initiative of generality of core members. But we are beginning to see a big relief in what we are doing in terms of what we have to provide to cater for the health of core members. That is not to say that we have gotten to where we are going, because of course we have to bend backwards at times to accommodate a few cases that are not covered by this initiative. But I can tell you that the initiative is achieving the purpose for which it was instituted by government.
Other presentations centered on roles and responsibilities of key stakeholders under the GIFSHIP-n, importance of teamwork and mutual respect, review of GIFSHIP-n sensitization exercise, etc. The high point of the workshop was the discussions where questions and answers on problems encountered on the field and their resolutions were shared.
Welcome back. At the NHIS NYSC workshop, participants were drawn from the two key stakeholders being the NHIS and the NYSC. Some of them speak on their perception of GIFSHIP-n.
My perception is that the GIFSHIP-n has brought a solution to a problem that existed in NYSC over time. I am so happy that what NYSC was struggling to do alone is now being carried on by others. You know, the problem, you see, I was director in Kano just immediately after that incident of Dolako. And so it was like managing so many problems at the same time. But when the tertiary institutions came, we got a little relief. But this is more perfect than ever before. The relationship between NHIA and the NYSC will give us solution to most of these health challenges we usually have in the NYSC.
GIFSHIP-n as a program, which is meant for youth but that is mobilized purpose, it's a laudable program. In fact, coming of GIFSHIP-n is so good that even the core members are so excited about it, as well as the NHIS and the NYSC. GIFSHIP-n, honestly, we cannot overemphasize it. One, it makes the purpose to be fully covered. That's to say, with the GIFSHIP-n, we'll be able to access our universal health coverage.
Some participants had this to say about the training workshop.
The workshop that we're doing today ensures that everybody understands his or her responsibility. All the stakeholders should know what they're supposed to do at any particular time so that there'll be efficiency and effectiveness in our operations. The basis is getting to know what we need to do, and then when we have that background, we can go home and perform better, especially those at the field. And then where there are hitches or challenges, we can resolve them here, and so it will make our work better. For instance, you know, I'm sure most of us have come to understand now that when a core member goes on relocation or is taken from a former place of deployment to another place, you know, it can easily be solved when you pass information from the area it was formerly deployed before. So the state coordinator of that your office, and so it makes it easier. You know, that transmission of information is better.
The significance of this program is beyond any commendation, because we in the field it will help us a lot, because this is an avenue where all the stakeholders are brought together to brush, discuss, analyze, and know the way forward on this program.
Some others speak on how the workshop would help them when they return to their various offices.
With GIFSHIP-n, it's such a beautiful thing because we are taking a further step to a younger generation. So coming to this program, what it has done for me is that I understand NYSC a little bit better now. I understand where they are coming from, the story behind it. So it will help me to relate with the officers of the NYSC perfectly well this time around. And of course, it will ease my oppression.
See the enlightenment gotten so far, the implementation of NYSC of GIFSHIP-n in Benin State is going to be more effective. Like in handling the challenges that we have encountered so far.
The health maintenance organizations were also not left behind. They also shared their thoughts on the workshop.
Yeah, actually, this training or workshop is timely because we just started the program 3 months ago, and we have seen a lot of challenges that come up during the implementation of the program this far. So this workshop gives us an avenue to look at the progress so far, where are the challenges, and how to overcome all those challenges. And I think we have done that today. We have addressed all those issues, and going forward, I think all those issues that arise will no longer be given.
I'm actually happy we had this workshop because initially we actually faced some challenges, of which we had to call the NYSC and the NHIS to lay our complaints to them. And I think that preempted this interview. And it's more of a pre-enlightenment talk. And I believe so far so good. They did well, and we'll have enough to take home and also do a step-down training when we get to our different facilities.
And that's it from the Stakeholders Corner. Let us take your questions in the segment.
Where do I register? How can I get enrolled? Where do I register? How can I get enrolled?
How can I get enrolled?
Does NHIS cover delivery commodities?
NHIS, when we talk about delivery, what NHIS does is that there's a little difference, or when you say the word commodities of a wider range. So what NHIS does is that it covers all the drugs and also the consumables. The word consumables are the ones that are more medically related. Things like syringe and needles, things like gauze that they use during the delivery, things like cotton wool, and things like sutures that they use for suturing during the process. But other commodities like soap, like sanitary pad, like the diaper pack that they use to clean the baby, such type of commodities are not covered under the scheme. So I think the enrollees or our mothers that are going, that is to the maternity area, should get this thing clear, that it is only the consumables that are being covered.
Where do I register? How can I get enrolled? Where do I register? How can I get enrolled?
How can I get enrolled?
I think I paid almost nothing.
It went easy. We only paid 10%.
We all work towards accelerating universal health coverage.
Everybody, irrespective of his gender, has access to basic healthcare services.
NHIS.
And so, we draw the curtains on this week's episode of the program Easy Access to Healthcare for All. The signing into law of the National Health Insurance Act has made the attainment of universal health coverage by 2030 a definite reality. Let's do our own part in drumming up support for the NHIS and creating awareness on health insurance for all Nigerians. See you next week, and bye for now.